And then go ahead, Vitri, then David and Jody.
Hey, Vitri.
Hey, Greg, can you
Hey,
hear
hey.
me?
Yeah. How are you?
Okay, good. I'm good, thanks. I have a question for myself.
Yes.
So I don't know whether you remember, I've been having leg issues.
Yes.
The left leg has some nerve pain and the right leg is more of muscle pain.
Okay.
But anyway, so I am scheduled to have a surgery done on my spine, especially because of the left leg
Right.
issue.
So they're doing a laminectomy or a fusion
Yes.
or what? Laminectomy.
Laminectomy
Okay.
on the thoracic,
Right.
and it's the T4, T5 area.
Right.
So
Wow, that's kind of high.
that's the back heart, is that right?
Yeah,
Kind of
it's
around that
like
area.
kind of towards the bottom of the shoulder blades, still in between the shoulder blades, like not below the shoulder blades, but like on the bottom portion of it.
Mhm.
Yeah.
So I'm wondering whether you have any suggestions before the surgery and after the surgery.
Okay, so anything you're doing two days before the surgery, I would stop everything.
Okay.
But prior, I would do galbanum and black cumin. I even like to do a little like blue healer or yarrow or German chamomile on the surgery site itself. Just to keep reducing inflammation, keep everything moving, clean up the metabolic waste in the area, all those kinds of things. Calm down the sensory nerves. And then that surgery is a pretty quick recovery rate. Like if I remember right, it's a little tiny hole. It's not usually very big. And so afterwards, I mean, I usually say, because of the surgery and everything, don't put anything on it until it closes. Like if it was an open wound, I would say just dump a bunch of helichrysum all over it. It will make it bind faster. But, it's a surgery site. They went deep and we don't want to freak out the doctor. And so like, they're trying to control the scene. So I usually say like, just wait until the wound closes. And then still put helichrysum on it just to reduce the fascial lesion, or it's what they call scar tissue. Like it's just like fascial, like it's like a spasm, but in the fascia. And that'll cut down your physical therapy time. It will cut down them having to do friction massage and all that kind of thing. And it makes that scar just nice and smooth and supple, and it's nice, and it reduces the pain and the inflammation. And then I just go back to the galbanum, the black cumin, and the blue healer or yarrow or German chamomile, like in a little bit of a liniment or ointment on the area, and then rotate putting on the helichrysum, and that's pretty solid. That will reduce pain, reduce inflammation, reduce the scar tissue. The galbanum will make your body tolerate the pain much better, and it takes like a kind of tension out of your body that comes with like pain and surgery and injuries and things like that. And the black cumin, again, reduces the inflammation. It will reduce any kind of internal scarring and definitely stimulates the healing process and is very anti-inflammatory. Sometimes with spinal stuff, I don't even know that they give you painkillers for that. I think they just tell you ibuprofen.
It looks like they will, because I had to sign 4 pages of this opioid usage.
Okay, so they are. So the thing with the opioids is it's going to cause constipation. And so, you could just use ginger, which is a very good, just digestive, like tonic / stimulant. Or let me see what else can work for. Yeah, Like rosemary, verbena, terebinth, lemongrass, all of that should be helpful for the constipation.
And that's ingesting?
Yeah, that will have to be ingested.
Okay.
Not tons, like a couple of drops, but I'd probably go the rosemary verbena route after after the surgery, but any of it will work.
Okay, I have that. Okay, so prior to the surgery, so like now I can apply galbanum and blue healer on the area. Is that what you're
You
saying?
apply blue healer to the area. Galbanum you can just put on your wrist, or
Okay.
you can just do like maybe 20-25 inhalations. I actually like putting it either on the wrist or taking a few drops internally. Just because it seems to have a deeper impact for like a physical pain syndrome. And then I would do bakuman as well. Yeah.
Yeah, I take that regularly. The
Yeah,
Blacumin.
perfect. Then you're doing all the right stuff. And again, rehab for that one is usually not too bad, and you're really just trying to get out of pain kind of quickly, and you know, you don't quite have the issue like they do, like if they're doing like a hip replacement or something, but I would just like maybe go around the house, move everything up a little bit higher so you don't have to do a lot of bending right off the bat.
Mhm.
And you know those aprons that you get at like the hardware store, like Lowe's or something, where it's like an apron you put around, it's got little pockets in it, like for nails and screws and all that kind of stuff.
Mhm.
Get that, keep your phone, like your tablet, like all the things that you kind of use like during the day so that you don't have to keep getting up and walking over to pick something up or bending over and everything,
Okay.
just for like a week or two. Like, and then after that, you'll be fine. But just
Great idea.
make yourself comfortable. Like
Mhm.
I started having patients do that with hip replacements, boy, like 20 years ago or something. And it was, you know, all the therapy, they would come back and go, that England thing was amazing. You know, it's just make yourself cozy and comfortable. Like, you know, you went through a surgery, let your body just totally let go and relax.
Okay. That sounds good. Do you think there's any energetic component to this?
As far as the like low back
The-
stuff just happens, yeah. I wouldn't read a whole lot into it.
Okay.
I mean, you know, as far as spinal stuff goes, like the neck and the low back are usually the things that kind of go first, but you're up in like T5, T6. That was probably some old injury. Like, you know, honestly, it was probably some that you might not even have registered it as an injury, like, and it could have been like a very long time ago. And just over the years, it just slowly kind of crept up to you. You know, given that spot, were you ever in a car accident?
I don't think so, but I did fall one time on concrete. I slept on ice,
Yeah,
and
was
it was
probably
a
it.
hard impact. Yeah.
Yeah, that was probably it. You know, like soon as that happens, like, you know, because I've had a bunch of falls and things, and you know, it was all in my youth, and as I got older, those are all the areas that I struggle with pain syndromes. You know, like a bit of arthritis or the areas bone on bone, or you know, something like that. And it throws that area in spasm, and if we could go back in time and undo the spasm, we'd reduce it. But you know, a decade goes by, 2 decades goes by, and it just turns into these little weird issues like that. You know, you can
Yeah,
always clean things up, but it's usually the result of an injury.
Okay. Yeah, according to the MRI, there's severe calcification, and so it's impinging on the spinal cord.
Yeah.
So there's no space around the spinal cord.
Yeah. That was probably an injury. That sounds like an injury to me.
Okay.
Yeah. So okay, so they're going to clean that up and do the laminectomy, and you should feel a lot of relief afterwards.
Okay.
Yeah. When is the surgery? I'm just curious.
2/22.
2/22.
February 22nd.
Yeah, couple weeks.
Yeah.
What's today, the 7th? So couple weeks and a day.
Yeah, 2 weeks from tomorrow. Yeah.
Yeah. Okay. Keep us posted on that. Just let us know how things are going and, before and after and all that. And yeah,
Okay, I will do that. Thank you, Greg.
you're so welcome. Good luck with that. Tell Paul hi for
Thank
me.
you. I will. Thank you.